No, we are starting 3, 2, 1. We are live, man. Please start.
Good morning, everyone. Thank you, Cipla and team, who gave this wonderful opportunity. I am Dr.C.Sankari, practicing at my own clinic for past 15 years at Kadalur, Tamil Nadu. Okay. Today we are going to discuss about the topic antibiotics in dental avulsion. As everyone know that without antibiotics, it is very difficult to treat infections, inflammations. In certain types of patient, it is very important to treat with antibiotics. What antibiotics play role in tooth avulsion? Systemic administration of antibiotics is generally recommended in order to prevent the harmful effects of bacterial contamination. Antibiotics decrease the incidence of inflammatory root resorption but have a limited or no effect on the pulp. Antibiotics also very important in anti-resorption therapy. What does mean by anti-resorption therapy? It is a technique that prevents inflammation after reimplantation using combination of antibiotics and corticosteroids. Reimplantation is a treatment of choice, time management, proper storage medium of the tooth, or all the crucial factors will guarantee a good prognosis. Whatever the proper treatment be done by the doctors, we follow the protocols. Antibiotics play a major role in dental avulsion cases. What does mean by dental avulsion? As everyone know that dental avulsion is a complete displacement of the tooth from its socket due to trauma. Various types of trauma happen. These are the some of the traumas happen to the tooth, like bike accident, during cycling, or while playing games, etc., etc. How you are going to manage? If a patient comes to a clinic with a tooth avulsion cases, how we are going to manage? Let's see. Okay. First, you have to see patient's age, medical status, root development, either complete root formation has done, open apex or closed apex, you have to see to it, and extra oral time. Storage media, if they have their tooth with them, you have to see the storage media, extra oral time, and all that. And development of dentition and face. These are the factors to be considered in the treatment of tooth avulsion. How you are going to manage tooth avulsion cases? First, examine the patient clearly. See the socket, either any foreign objects or any trauma happened to the tooth. At the socket area, everything. And see the tooth also. If it is milk tooth or deciduous tooth, whatever be, it is not necessary to re-implant. Just seek a immediate dental care. If it is a permanent tooth, as for any serious condition they are having, or if they need any medical condition to be treated, if so, seek a immediate medical care. If not, everything is fine, just able to replant immediately or not, just see to it. If you can able to reimplant immediately, then proceed for the treatment. Hold the crown without touching the tooth surface like this. Always you should hold the crown surface, not the root surface of the tooth. And do not rinse it more under the running water. Just rinse it gently and reimplant the tooth with a gentle pressure. And main thing, before you are going to start the procedure, give LA to the patient, as everyone know. Just I am informing. After LA, replant the tooth immediately as soon as possible, just applying with gentle pressure. And one more thing, there is a two option. You can do root canal treatment before implantation of the tooth or also after 10 days follow. But my suggestion is do the root canal treatment before inserting into the socket, because after 10 days if you are going to disturb the tooth again, so it will be little bit mobility and maybe it takes some more time to heal. So it is always better do the root canal treatment externally and insert the tooth inside the socket as soon as possible. Just give a gentle pressure, check for the occlusion and bite on the gauze piece. If you can't able to replant immediately, put it in a cold milk or with the patient's own saliva and seek for a dental care. These are the protocol management of owls tooth with closed apex. These are the various storage media according to the extraoral time. If if you are having going to reimplant within 15 minutes, you have to follow these types of procedures. Above 15 to 20 minutes, change the transport media, and greater than 60 minutes, you have to see this procedure. Soak in citric acid for 3 minutes and place it for 20 minutes, then root canal therapy, and these are the protocols to be followed. But frankly speaking, one of the cases I've done, patient came after 2 days only, but I reimplanted, just I washed with a clean saline and reinserted the tooth surface. And now the patient is almost 2 years over. They're completely fine and no mobility and everything is fine. But it won't work in all the cases. You have to see the tooth surface, patients, medical conditions, everything. And after reimplant, check for the position with IOPA. Place a flexible splint to avoid the mobility of the tooth. And start with systemic antibiotics. Give a post-op instructions like should not eat particles, should not bite inside. And the main necessary point of anti-tetanus if required. TT injection is very, because if the patient soiled tooth, it may give infection, maybe resorption will happen, everything. So tetanus is very important to the patient. Follow in 7 to 10 days. Then after 1 month, follow up is needed. This is a tooth fracture case due to cycle race. Patient of 15 years old girl came to my clinic. She met with an accident before 2 hours. And she and her father came to my clinic and patient was good. Medical condition was fine. So I examined the patient. The socket is very nice. And I asked for the tooth. They said, we are not having any tooth. I said, like, if possible, if you can bring back your tooth, we can have the treatment with their own natural tooth. They were surprised to hear that because many patient was not aware of that. So I explained the treatment plan to the patient. Then patient father was in a surprise that can we able to bring back the tooth, because accident was happened before almost before 2 hours. They were in a very confused state. I said that let's hope for the best and go and search for the tooth. Immediately patient father went and searched for the tooth. Almost he searched for half an hour and he got the tooth with a happy face. He came to my clinic and he said that he got a daughter's tooth. Then I saw the tooth. It was a little bit soily at the root surface, as it was early morning on the roadside. It was very soily. So I gently cleaned the root surfaces with a saline and then root canal treatment externally. Always hold the tooth only at the crown portion. Do not touch at the root surfaces. So this finger you can see, while I took x-ray, I hold the tooth surface like this only and took x-ray. Root canal treatment is completely done. Can you able to see this? After root canal treatment, I started inserting into the girl's socket. You can see now. Just slowly insert the tooth. Just apply a gentle pressure and check for the position of the tooth. Either you are placing correctly the labial position, palatal position, you have to check. If everything is spot, then go for splinting. After insertion, check for the position with, you can confirm with x-ray also. After everything is okay, then go for splinting. Splinting you can done from anterior, from canine to canine also, or from lateral to laterals also, but canine to canine will be much better. So splinting is done. This is the tooth surfaces. This is the tooth we inserted recently and patient is fine. Check for the occlusion and advise medication, soft diet, and most importantly, antibiotics for 5 to 7 days. This is after 1 month follow-up. You can clearly see healing was completely nice and see the periapical region and all very clear, no lesions present here, and tooth surface you can check for the mobility, not even slight mobility, grade 1 mobility, nothing. The tooth was very firm after 1 month follow-up x-ray itself. You can notice this. This is before 1 month and this is after 1 month, and I removed the splinting after 1 month. Patient mobility was good and tooth is very firm, and she was very happy with this treatment as she got back her tooth, and patient father also very happy, and they were like they couldn't believe also even we can replace the original tooth, and you can see. And after that, this fractures tooth surface I replaced with light cure JIC. This is another case, another road accident case, a male patient of 34 years old. In this case, patient met with an accident, but he came after 2 days only. After 2 days, while I am examining, the socket was like this. So I was in a doubt, can we able to replace it or not? But I informed to the patient, if possible, let's give a try. So I cleaned the socket with a saline and chlorhexidine mouthwash, and I told the patient the same history. Can you able to find out your tooth? He said, how it is possible? Then surprisingly, he went and he got back his tooth. This is a tooth The same procedure I followed and reimplanted it, and splinting was done. This is after 1 month of reimplantation of the tooth. So this all happens because antibiotics, mainly of antibiotics, because antibiotics play a very good role in treating infections. So only we can able to do this type of procedures in dentistry. And thank you for watching. If you are having any doubts, please text me or you can message me. Thank you. Thank you for watching.